So I think there are several primary benefits. As far as early benefits, we are doing way less soft tissue releases. So that being said, patients are having far less pain, and having far less pain means that their recovery seems to be moving in a quicker direction. And so that combined with the dynamic gap balancing or the dynamic ligament tensioning that we can get from the Newton, we're seeing better range of motion, especially early on. So by 3 weeks, a lot of patients are already past 90 degrees of flexion. They have full extension. Many of them are already off of a cane by that point in time, and they have a lot less pain than what we've seen in the past, especially the varus knee where we were doing big post-roll medial releases on the MCL. There's far less medial joint line pain than we've seen in the past.